Hey peeps. Today let's go over electrosurgery basics. So we use electrosurgery in the operating room almost every single operation, and there are a lot of terms that get thrown around that I think get confused. So let's straighten some things out during this lecture. So first, what is electrosurgery? Electrosurgery is an alternating current that heats tissue by conduction of electric current. So in the OR, we are using electrosurgery, not electrocautery. So sometimes you'll hear electrocautery, but that's a direct current. It comes from a power source that heats an instrument, and the heat is then transferred to the patient. The current does not go through the patient. So I put some like electrocautery tips here, which are not the tips that we use. This is a passive form of electric cautery, for lack of a better word. I like to think of it as like this iron poker. Obviously, this is not electric, but it is the cautery portion of the definition. The heat of the device makes direct contact and then cauterizes. There's no current. But we will be going over electrosurgery for the remainder of the lecture. Okay, some terms here that I want to define. I'm not going to go through all of them, just current, which is the flow of the electrical charge. The source we'll be talking about during this entire lecture is an electrogenerator. Current is also the number of electrons passing a given point in 1 second, and it's measured in amps. These other terms are very important for you to know, but I'm not going to be touching on them during this lecture, so they're for your entertainment. Okay, we briefly touched on current types. We know that we are using an alternating current with electrosurgery, and then a direct current is used with electrocautery. The direct current is always flowing in the same direction, kind of like a battery, positive to negative. The alternating current is like what we have from an electrical socket. We use alternating current in the United States, and the direction, it's called alternating because the direction alternates. The electrosurgical unit, or otherwise this generator, so ESU will mean these generators here, are used in the operating room to convert the standard electrical frequency from the wall to a much higher frequency. And it's really important to know that because this essentially avoids electrocution. Higher frequencies minimize nerve and muscle stimulation, which occur at lower electrical currents. And as you can see here, electrosurgery is a very high electrical current, so it bypasses that. And we'll be discussing this alternating current from here on out. So I think this is the most important slide of the entire lecture because it differentiates these terms which oftentimes get confused. So circuits are monopolar and bipolar, waveforms, cut and coag, and then tissue effects, vaporization, fulguration, and desiccation. And so let's talk about each one of these separately and then we'll bring it all together. Okay, the first circuit is the monopolar circuit. This is a picture here. So it travels from the generator via copper wire to the electrode, the active electrode. Here it looks like potentially a bovie. This is where the action occurs, and then it goes through the patient's body to the return electrode, which eventually returns that to the generator. The return electrode, or the dispersive electrode, you probably have heard called the grounding pad. This should not technically be called a grounding pad because we are not grounding the patient. This circuit is an isolated circuit. And so you can call it the dispersive electrode, you can call it the return electrode. Maybe no one will know what you're saying if you use those terms, so you may have to call it a grounding pad, but that is a misnomer. The dispersive electrode should be a large pad. The larger it is, the more current that will be dispersed, and that's safer. It should be placed on a well-vascularized area, a muscular area, close to the operating site, and away from any metal implants. The bipolar circuit is much different. So you'll see here in picture B, 2 wires leave the generator. The first wire connects to the active electrode, and then the second wire is the return electrode. This current is contained between these two and like whatever tissue you're grabbing. It does not traverse the patient's body, much different than a monopolar circuit. Now let's get into waveforms. So this will be cut and coag here. So the cutting waveform is right here. You'll see it's a very high current flow. It's 100% on all the time. It's low voltage, so you can see in comparison to coag, it's a lower voltage because it's always on. And it rapidly heats, it's rapidly high tissue temperatures. And we'll talk a little bit more about tissue effects, but it goes along with vaporization. This is in contrast to the coag waveform, which is over here. This is only on 6% of the time. It's an interrupted waveform. Has very high voltage, as you can see, lower tissue temperatures, and is more associated with desiccation and fulguration. Although the cut waveform can also desiccate, and we'll talk about that. And then the blend waveform here is showing you an example of all three. You will decide what type of blend you like, but 50-50 is just an easy example. So 50% on, 50% off. This is not 50% on cut, 50% on coag. It's on 50% of the time, kind of like the picture shown. And 50% of the time it's on cut, and 50% of the time it's off. So the blend waveform is actually talking about the cutting waveform. Okay, now completely separate but tissue effects. There's vaporization, fulguration, and desiccation. So we'll talk about each one here. First is vaporization. And so this is when the tissue is rapidly divided by rapidly heated cells. This is this first one here. It's a deep injury with minimal lateral damage. Vaporization is a non-contact form of dividing cells, and it's the cut waveform. So as we mentioned earlier, on cut, when you're kind of just above the tissue, you're vaporizing tissue. Fulguration is the coag waveform. It is a superficial but wide charring of the tissue. It's also non-contact and high voltage. So you need a high voltage of the coagulation waveform in order for the kind of spark to jump across the space and coagulate those cells. And then desiccation, like I mentioned, you could either use in cut or coag waveforms. So this is when you're actually contacting tissue. Ions and water are driven out of the cells, and it's a deep penetrating tissue effect. So like I said, either cut or coag waveforms, but the cut waveform is a more thorough coagulation, a more thorough burn. So this is an example here. You see pure cut, which we just talked about, is vaporization. And so it's going to be a deep, non-lateralizing spread. Coag is a more superficial, but kind of a wider char, as you can see here. And then blend is kind of a blend of the two. So if we're talking about opening an incision, that would be preferred to be a cutting waveform. That you're using vaporization. It's a deep vaporization, but minimal lateral thermal spread, and that's what you want for the skin. If you have some surface bleeding, like a little bit of bleeding here, that would be perfect for your coagulation waveform or fulguration, which is a superficial char on the tissue. And then if you are picking up a vessel, this is not a vessel, but say you're picking something up in contact and you need to decide, should I use cut or coag? You can technically use either. This is a form of desiccation. Remember, desiccation, you can have cut or coag. And a lot of people will use coag because you get that pop, you get that spark, and it's kind of a really just good feeling to see that. You're like, yeah, I got that vessel. But the coag waveform actually will give you more depth and penetration with less lateral spread. So, try it next time. See if it works for you. some people just can't get away from that nice popping noise. That's satisfying is the word I was looking for. Well, great. So that was pretty quick, but feel free to leave any questions or comments down below. And I just wanted to draw your attention to this lecture here by Dr. Malad from Northwestern. It's on this website here that was created during COVID, but it is an excellent electrosurgery lecture. He also has a YouTube channel where he does some other demonstrations of electrosurgery. So if you're dying for more after this lecture because you learned so much, then head over to this. And I just wanted to give him credit because I learned so much from him. So the power of technology and some of the benefits that COVID brought us. I hope you learned some things from this lecture and have a great day.